We are continuing on with this series of this Russian roulette of topics where we are just going to go ahead in blind and just chat as it flows
Argue.
naturally and or argue potentially. We're going to try to avoid that though so that the whole world doesn't see it. All right, Janelle, pick our topic.
Okay. Is plastic surgery having a moment?
Ooh,
This is good timing.
I think this is a good one for both of us. Janelle, why is it good timing? Tell us.
I am 2 weeks off the knife.
Off the knife.
Yeah.
What did you have done? I mean, I know what you had done.
had a
but let's
quad
share.
bleph and an earlobe reduction.
What does a quad bleph mean?
And
why
what I
does one
thought
need an
were
earlobe
3 moles
reduction?
being taken off and 20 were. I had no clue I had that many on my face.
What was the name of that Hansel and Gretel? Remember the
You already lost me.
You've never heard of Hansel and Gretel?
I've heard of it.
Well, whenever I think of lots of moles, I think of this
Sounds so
Hansel and
gross.
Gretel villain. Anyways, carry on.
A quad bleph is an upper and lower eyelid surgery.
Okay.
So they take fat or skin from the top lid, remove it so that your eyes look more open and refreshed. And then the bottom would be fat repurposing. So either you
Not
have
always though, right?
bags, either you have hollowness. So Dr. Rice repurposed the fat underneath.
You went to Dr. Rice.
Yeah, to make
At
it
Aesthetic
more
Center.
even. Yes.
Yes.
In El Dorado Hills.
Okay. And I would say, and maybe everyone's a little bit different. So I also had a bleph. I did not have a quad bleph, but I had an upper bleph, and I have naturally hooded eyes, and I did not want to change that. And I actually really loved my experience because I was worried that someone was going to want to take my hooding away. But if that would happen, it would no longer look natural. I do think that people looking unnatural, I think that's a lot of concern for people out there. And it was mine as well. I just was afraid that I was not going to look like myself. In my 20s, I had hooded eyes. So you take that away from me, I'm not going to look like myself. I'm going to look like a different person. And I was really happy with what I also went to Aesthetic Center, but I went to Dr. Vinci, and I was really happy with my results because you can see more of my lid now. It looks like my lids looked 10 years ago, maybe longer. I have to go back to pictures, but I was really excited with that. And I do think that plastic surgery is having a moment. And the reason why I think it's having a moment, you know what? I'll take that back. I don't think it's having a moment. I think that it's in the spotlight right now. And I think that this is runway for it. I think it's only going to have momentum. And I feel like when you say a moment, implies like it's a blip. And I don't think it is. Like,
Yeah.
I really feel like we're going to see it take off. But I think a lot of that has to do with surgeries like this. Like previously, at least I don't know for you, prior to getting into the industry and working more closely with plastic surgeons, because I was in med spa a lot longer before I started working with plastic surgeons outside of some like breast aug and things like that. And I just thought like you didn't do things to your face until you were in your 70s.
Yeah, that's exactly how I thought.
Right?
I never would think someone in their 30s or 40s.
Someone as young as us would ever consider facial plastic surgery. But it's more common now. And again, it goes back to you can do this more naturally. And I mean, honestly, even facelifts, like people that are younger in their 40s are doing facelifts now. Anything you want to say on that? Because I will go off on a tangent and I do not want to take this
Well,
whole thing.
I just think the thing is you don't have to go from 0 to 100. So it can be really scary, but it doesn't have to be. And I think that's the beauty of working with your surgeon and coming up with what feels right for you. And that was my experience.
Yeah.
I'm willing to say that was probably yours as well.
Yeah.
Is that it doesn't have to be just like the med spa industry and people getting Botox and filler. Everyone goes to the extreme and is scared of the extreme, which
That's
is
so true.
natural.
I didn't think about that, but that's so true.
And people think like, yes, you're messing with your face and now I can't reverse anything that happens. It doesn't have to be like that. It's a collaboration, honestly, with who's going to be performing the service.
I will say that was a big fear. And I'm not afraid to say, like, obviously this is me, but I am married. I've been married for 22 years, a very long time. I know I don't look old enough to be married 22 years. I know, I understand. However, I am. And so it was a conversation that I had with my husband too, with Zach. And I will say he trusted the doctors, but it is a little nerve-wracking when you think that someone's going to not look like themselves. Yeah. And he was like, oh yeah, looks great. You know, to him, it was like refreshed. And so I think that's the other thing too, is just sometimes you have to have those conversations. You talked about having a plan. I do want to go back to the facelifts a little bit, that I was kind of leaning into, which is that's happening more and it's happening
Mhm.
younger and techniques have changed. And I think that's a big piece too of why um, plastic surgery is starting to gain momentum is that not only have the techniques changed, but we have platforms that are allowing them to show that more. So Instagram,
Yeah.
TikTok, YouTube, you have more people talking about what they're doing. I will say I am and I'm not a fan of the people that speculate. You know, you've seen people
Oh,
that
yeah.
they're
Like,
like,
did she do this? Did she not do
yeah,
this? Yeah.
it's I'm on the fence about that. I don't want to take a stand for all of eternity because this podcast
I
will be
literally
available
could care
forever.
less if they did or not.
I could care
That's
less
where
if
I'm
they
at.
did or did not, but I will say that it did help me when looking at my bleph surgery of like, what does it look like? How extreme is it when you do it? And what will
Mhm.
change? And so I will say that those that went on record, thank you. I
Yeah.
appreciated it. It was helpful. Speculations helped a little bit. I don't love that as much. But I think the more that people are willing to say what they've done and you can see the before and afters and how it can be natural, the
Mhm.
same way that you mentioned we can talk about fillers, it was no longer it wasn't scary. It wasn't as scary because
Yeah.
there's still a level of like fear, but it was not as scary because you could see how people were just looked really great. And more people are doing that. I love Anne Hathaway's look. I think she looks phenomenal and she has had, you know, a variety of things done. So I think that that is helping with the
Yeah.
momentum and also the idea that you can have facelifts younger, you can do all of this, you know, you will have the plastic surgeon weigh in and they'll tell you, you know, what you're the right candidate for at that stage in your life. I mean, there's neck lifts. Bottom line is it looks really, really
Yeah.
natural and it looks really, really good.
We've seen an uptick. I mean, so from like a data perspective, we've seen an uptick in surgery just in general over the last couple years. It's
Yeah.
absolutely growing. We've also seen an uptick in hair transplants.
Oh, interesting.
Yeah, which is interesting because
I
it's
feel like
such a
that's
niche treat.
barely
Yeah,
getting
it
on its
is.
feet. I feel like plastic surgery might be ahead of it a little bit, and then hair probably is like coming behind.
Turkey really started the
Turkey, yeah. I was like,
Instagram.
turkey. Why did I immediately think of the actual
Yeah.
animal turkey? I'm like, what does turkey have anything to do with this? But yes, okay. I'm on board
Yeah.
now.
So sometimes when I think of plastic surgery, I immediately think of like females and
Yeah.
getting right the stuff we've done.
Mhm.
But there's also this male population too. It could be male and female
Yeah.
growing in this category, which I
Right.
think is really fascinating.
Well, I think it's exciting. I predicted this towards the beginning of the year that I thought it was its moment. So let's talk a little bit into about our experiences because both we shared one. Well, we didn't share a experience. We shared
Mhm.
a similar experience after talking about it. We had other friends who have now since done plastic surgery as well and also shared their experience. So the more and more that it's getting popular, same with med spa, more important it is going to be to stand out because there are incredible plastic
Mhm.
surgeons. So, what makes the plastic surgeon stand out? What makes the practice stand out? And I would like to share that with the listeners who have plastic surgery as part of their practice. So, what were the standouts for you? And I won't duplicate yours. I'll try to tack on or
Okay. For me, I guess I didn't fully know what to go in expecting at
mm.
all because I've not really done this and I've never sat in on it like a full consultation, which is my
Oh, you
bad. I'll
haven't?
admit. No. So because
But you
this
didn't even personally have like a full consultation previously?
I did, but it wasn't nearly the same
Okay,
experience
so I
as
think
what I
that's
had
important to point
before.
out
Okay.
because you have had plastic
I
surgery
have.
experiences before,
I
and
did
this
like
stood out.
15 years ago
Yes,
somewhere
but
else. Yeah.
still, this stood out. Okay, we'll
Yeah.
get into that. Tell us more about why this was different.
Okay. It was very clearly communicated from the start of what I could expect. And then I got materials to take home with me
Mhm,
to with credentialing on the
mhm,
doctor, like a pre and post, what I could expect
mhm,
going forward. And then after my treatment, what that would look like. I got to see before and after photos. They took photos of me. And then together with Dr. Rice, we went on like, how does this look? Is this the
mhm,
look you're going for? Here's what it would look like with more. Here's what it would look like with less. Like, where are you
mm.
at in this whole process? So that to me helped because I could actually visualize, okay,
They did
this
that
is
for your eyes too?
no, for
Oh,
the other
got it,
things I was
got it.
looking at doing.
Okay.
But that to me helped visualize like, okay, I can know now.
Like,
Is
I
this the
do or
look
I
I
don't want
want?
this, yeah.
Yeah, yeah, exactly. Am I going to commit to this or not?
Right.
Um, what stood out the most, though, was the level of care from every individual along the way. Now, I
Mhm,
think being in this industry, it could be easy to be like, they know, they
mhm.
understand, they've worked with us for a long time.
Yeah,
They know they can trust that we are who we are.
right.
I felt like I was getting the same level of care that anybody off the street or whoever's booking an
Yeah.
appointment was gonna get or was
Yeah.
getting, which
Right.
made me feel like I felt like I could trust that I
Mhm.
was in the best care possible,
Mhm.
which relieved a lot of like the older you get, I hate to admit this, I used to have zero fear of anything.
Yeah.
I don't know what's gone on, but now I'm
I
way
agree.
more anxious than I've ever been about stuff, and I'm
I
like,
agree.
"Is this do I really need to be do I need to do this? No." Like, let's be honest. No, I don't need to.
This is a total tangent. My biggest fear as I'm getting older is breaking a hip. Carry on.
So, when there's something elective like this, there's a different level as you get older where you're like, "Is the risk worth the reward?"
Yeah.
Right? And so you have to weigh all that out.
Mhm.
So, a big piece of going into this process is, do I trust that this is the right thing to do knowing what some of the
Yeah.
potential risks may be? And
Right.
I never questioned that along and throughout the entire process, including the follow-up process, including the next day, the text messages, even from Tiffany
Mhm.
afterward, like, "How are you feeling?"
Yeah.
There's just such a different level of care
Yeah.
that it's almost hard to, like, describe until you go through it.
It and some people may never go through it though, because I
Yeah.
do think the plastic surgery center and the plastic surgeon that you choose matter, because we
Mhm.
have both had plastic surgery prior to this, and I will agree that it was not the same. Like, I
Mhm.
was chasing at one point, like, chasing the person down to ask questions, and
That's scary.
almost felt like, I mean, and it was a reputable plastic surgeon. So it wasn't the skill level, it wasn't
Mhm.
them, it was just I had concerns, I had questions, and I almost felt like I was putting them out, like, when I was asking these questions. And very similar to your experience, one thing that I will add that stood out to me, well, 2. Um, One was the pre-care and the
Mhm.
post-care. I've never experienced anything like that. Like, they took the prep and the healing process very seriously. So, I was sent home with, like, various vitamins and what do you call the oh, supplements, that's the
Mhm.
word I was looking for, supplements in preparation for this treatment. And then post-care, like, after you're done, you're gonna continue to take these vitamins to help with your healing process. And I will say my healing was
Oh,
very
yeah.
quick. And then looking at yours was a little more intense, but every day you're healing,
Yeah.
like, you could see the dramatic change
I
of
know.
how
I can't wait to post
quickly.
too because I also did a
Wait, and then remind us
CO2
again. Wait,
laser.
how far off of
Right
your
now,
surgery?
14 days.
See, this is crazy. So this
Yeah.
is just 2 weeks. Look directly into the camera, Janelle. So
It's
that's nuts, and I
I
think
was
mine is like
like
12 weeks.
yeah, 6 days after, I'd say I was like, "Okay, I feel
And
much better and,
I
like, back to normal."
and I think I do think it's a Bleph is much easier, procedure than most people think, but also I do think that it is the preparation that they have us
Mhm.
put into it as far as, like, the supplements. And then the other thing I would say is I know that you said, Tiffany messaged you, Dr. Vinci was
Mhm.
messaging me, like,
Mhm.
"How's it going? How are things?" And I was not afraid to say, like, "Hey, is this normal?" And she's like, "Yeah, it's totally normal." And everything she said, I didn't feel dismissed, I didn't feel like I was putting her out. Like, it was just an incredible experience, and to your point, honestly, I would have been fine if they were like, "Here's your quote, here's your booking." I would have been
Mhm.
like, "Cool." But going through the process of the consultation, then the actual, like, talking with the MA and them going through everything, the questions, having that booklet to take home, because what I will say from my first experience at another plastic surgeon, it was a lot of information to take in.
Mhm.
And I'm not gonna remember that. I'm not, because I'm thinking of so many different things when you're telling me that when it comes down to it and time to do what you're telling me to do, I'm not gonna remember anything. So I remember getting that book, sitting down, going through everything, getting my phone, my calendar, aligning when I was taking my supplements, like, what were the things that I needed in preparation for this procedure, and having that to go to was a very unique experience to me. Um, so as a practice, if you have plastic surgery, saying that you're the best is great. Having a really qualified surgeon is great. It's not enough anymore. Like,
Mhm.
we want all of that, but we also want the care. And I think this is a speculation on my part and how I feel, but I would love to hear your point on it too. I think that in a world where we're so detached, where everything is screens and AI, that now in our industry, a personal touch means a lot.
Yeah.
So, like, back in the day when we were having to chase down surgeons who were not connecting with us, that didn't feel good. I think it feels even worse now
Yeah.
because we're craving that connection, and there's not much in aesthetics that you can do that is a bigger leap than actual plastic surgery. So having that human touch from everyone that I talked to made a big difference to
Mhm.
me.
Yeah, I would agree, and it's what we've talked about before, just like with med spa and how do we separate ourselves. This is gonna be one of the biggest things, and you get a feeling, it's either good or bad,
Yeah.
when you meet with your surgeon or when you
Mhm.
not even when you meet with your surgeon, when you
When
walk
you walk through the
into the
door.
practice, when you
Yeah.
make that phone call, this is an even bigger decision in my opinion than
Mhm.
finally pulling the trigger on filler or maybe
Yeah.
a deep CO2 laser.
Yeah.
So, all of it matters, and if
Yeah.
your whole team has to this goes back to culture, which we talk about in almost every episode.
Yeah, it's important.
If you do not have that, you're potentially losing people and you don't even know it.
Yeah, I agree. And I will say that in the past now in talking about like how do you grow your practice and how do you get more attention? So maybe you have all of it. You've got the incredible staff, you've got the incredible surgeon, the experience. How do you get the word out? Well, we talked a little bit about that too as far as, social media is great. Like if you have clients that are willing to share their before and afters, I think that is
That's the
powerful.
most telling is, like,
It
what
is
their journey was
huge.
like day 135/7.
Yeah, showing the journey, talking about the experience is a big deal. I know that in some of our practices, they also do lunch and learns
Mhm.
because a lot of people, I think the biggest thing is people don't want to be sold on surgery.
Yeah.
It's not a selling thing. And if anyone is out there bargain shopping for their plastic surgery,
Yikes.
to say the least, like yikes to say the least. I'm not trying to throw shade. If you're out there and you are price shopping, I get it. Like price matters absolutely. It it's a factor. I'm not saying it should be. But should you compromise on your quality of care for price? No, you should probably just not do it yet. I would just wait. So, at the end of the day, like it's not about selling them. People want to be heard. They're afraid. We talked about the fears that we have. The idea is to get there in person in some of these, these broad, less intimidating lunch and learns, to ask
Mhm.
questions, to meet with the surgeon, to
Look at the
understand.
before and
Look at
afters.
before and afters.
Yeah.
Oh, that's another one. Have a before and
Yeah.
afters book. That's a big one so that people can actually see. I will say Instagram is a before and after book as well, but it's sometimes nice to have that physical one in your practice. But then also, maybe our team at MedSpa Marketing can dig into this a little bit more, but also talking about, is it right to do ads and discount, and people
Mhm.
looking at was on this for the discount surgery offers, and are digital ads the way to go when you are trying to get the word out? So there are lots of different things that you can do, but the bottom line is after my surgery, I talked to you, we
Yep.
talked to a friend, I
I've
talked to
had people
another
ask me
friend.
yep.
Like it's going to be referral. So if you
Yeah.
deliver a great experience, like your biggest result I think is going to be in referrals.
I agree.
And then what if you don't have a plastic surgery practice? Does this matter to you at all? Can you benefit from this? I say yes.
I say yes too, and what I would say is you wanna look for this so that you can refer your clients to someone who's giving these types of results, and
Mhm.
people are speaking this highly of these surgeons, because that's also we've talked about too. If I'm referring you to someone,
Yeah.
like, my name is on that now. So
Right.
if I'm not fully bought in, that looks bad on me.
It impacts your reputation.
So I think it's good to partner with surgeons that you fully trust and believe in as well,
They're
and
going to ask.
yeah.
I mean, it's inevitable. Like it's going to be a step, and there will be patients that come to you that are not candidates for non-invasive elective aesthetics. They're
Mhm.
going to be candidates for plastic surgery. You're going to want to feel confident in who you refer to. Not all plastic surgeons want to offer Botox and filler because they're so busy with plastic surgery, so they'll refer back. But all that being said, all of the principles we shared are still applicable to your med spa. Even if you don't have plastic surgery, the idea is, again, it goes back to that human connection, that follow up, being
Mhm.
able to follow up with patients, not them having to follow up with you, and
Providing enough information too.
providing enough
Pre, post, what
information.
can they expect? We live in this
Mhm.
world and we just sometimes assume
Mhm.
they've done their research or they
Right.
know or they've seen it on Instagram. We can
Right.
never assume that, and it's always best to go above and
Right.
beyond.
And when you talk to them, it's not about if we came in and we're like, this is what we want. And they're like, great, let's get to cutting. Like, no, that's not what happens. They're like, well, let's talk about what's best for you. I don't think you need this, or maybe you need this instead. The plastic surgeon, and no one's going to disagree with a plastic surgeon as far as like, well, no, I said I want this.
Mhm.
It's the same thing in the medical spa practice. Remember, it's in the same vein. Like, you guys are the professionals and they're coming in and they may have done their research and say, "Here's what I want," but at the end of the day, from an ethical perspective and from the best aesthetic result, you have to drive that. So, whether you're a plastic surgery practice or you're a med spa practice, hopefully there were still takeaways from this, and super excited to see everyone's before and afters coming out of this and all of
Yes.
the blephs as a result.